Welcome, doctors. Managing a hospital's revenue cycle is already a challenge, but when we step into the world of specialty claims, the complexity multiplies. These claims aren't like your routine billing. They involve high-cost medications and treatments that demand prior authorization, strict documentation, and payer-specific compliance. And if any piece of the process goes wrong, it can mean delayed reimbursements and unnecessary financial strain on your organization. So, let's break this down. What exactly are specialty claims? Think oncology, rheumatology, cardiology, transplant services, and specialty pharmacy medications. These aren't just high cost, they're also high risk. Every step is under payer scrutiny, every document needs to be perfect, any delay can directly impact patient access to critical treatments. Now, let's talk about the biggest complications you face every day. First, prior authorization. Almost every specialty treatment requires it. Miss a deadline, let an approval expire, or fail to provide enough clinical detail, and the claim stalls. Suddenly, you're stuck in cycles of rejection and resubmission. Second, the coordination headache. Specialty claims involve multiple players: physicians, hospitals, pharmacies, payers. If one link in that chain is misaligned, it leads straight to a denial. Then there's coding and billing precision. A single wrong CPT, HCPCS, or NDC code can cause underpayments or outright denials. And just when your team gets it right, payers may update requirements without notice, leaving your staff scrambling. And we can't ignore denials themselves. Specialty claims face much higher denial rates than standard claims, often tied to missing documentation, prior auth issues, or payer-specific rules. Each denial stretches your revenue cycle longer and eats up administrative resources. Another key factor: patient financial responsibility. Specialty care often means high out-of-pocket costs. Without strong financial counseling or support programs, patients can't afford therapies and you face unpaid balances. On top of this, drug reimbursement remains a constant battle. Acquisition costs rarely align with what payers reimburse, putting hospitals at serious financial risk. Add in regulatory compliance, CMS guidelines, state rules, site of care restrictions, and the burden grows even heavier. The result? Delayed cash flow, higher admin costs, and even patient care interruptions. Specialty claims, if not managed properly, become a direct threat to both hospital finances and patient outcomes. But here's the good news: there are proven strategies to take control. Hospitals that thrive in specialty claims management focus on 6 core areas. They build robust prior authorization management teams, often supported by automation. They invest in integrated technology RCM platforms that offer real-time eligibility checks, drug tracking, and payer policy updates. They prioritize staff training so billing and coding specialists know payer-specific requirements inside and out. They create denial prevention and appeals strategies, using templates and analytics to cut repetitive errors and speed up recoveries. They strengthen patient support programs, offering counseling, education, and copay assistance to reduce financial barriers. And most importantly, they foster collaboration between clinical and financial teams because accurate documentation and medical necessity justification are what keep claims moving. So, what's the takeaway? Specialty claims are one of the most complex and costly aspects of the revenue cycle. But with the right mix of proactive authorization, payer expertise, technology, and patient support, hospitals can reduce complications, accelerate reimbursements, and protect both their financial health and their patients' access to care. Thank you, doctors, for your time and dedication. Managing specialty claims is no easy task, but your efforts directly safeguard not just hospital revenue but patient lives.